So I'm going to talk about how we leverage the power of artificial intelligence to provide a deeper understanding of human meibomian gland morphology and its clinical implication. I have no conflict of interest, and this work is sponsored by NIH and Roberta Smith Research Fund. Today, clinicians can easily visualize meibomian glands and using an infrared camera. And here are some examples of meibography images showing a whole variety of gland characteristics. However, today we don't have a fast and accurate way to quantify these features, so clinicians continue to rely on subjective visual assessment of these glands. To address this, it doesn't advance here, okay? It's okay, I can just look at that. To address the current challenge, we have trained a supervised machine learning to rapidly segment and quantify each individual gland. We use a convolutional neural network that was trained on human annotated images and also validated on novel images that our AI has never seen. So after many rounds of training, validation, and evaluation on over 2,000 images, we have an AI that can reliably quantify the following features, including visible gland and the gland density, atrophy area, and ghost gland, as well as length, width, tortuosity, and local contrast. We also developed a prediction model, a data-driven prediction model that combines the AI-generated metrics of the morphology with their matching clinical data. And the clinical data include the diagnosis, clinical signs, symptom, demographic factors, as well as lifestyle factors, including the contact lens-related information. So we wanted to predict a variety of clinical factors. And so here's what we learned from our model. Our AI can take meibography images to predict patients' characteristics. So with a simple scan, our AI can put that scan in the correct age group. And it can also tell whether or not this image is coming from an Asian or Caucasian subject. Our AI can also take the morphology images to predict dry eye signs. For example, atrophy can predict the hyperepitheliopathy and also predict corneal staining as an example. Our AI can also take the morphology to predict diagnosis, such as meibomian gland dysfunction, aqueous deficiency dry eye, and blepharitis with very high accuracy. Interestingly, our AI cannot tell the difference in meibography images between contact lens and no contact lenses. So the current study, the objective is to take traditional statistical analysis with a priori assumptions to more carefully assess the relationship between contact lens status and morphology. And just a little preview of our result. The most notable difference that we could find between the contact lens wearer and no contact lens wearer is the gland length. And as you can see, the difference is about 0.3 millimeter in the upper lid and 0.23 millimeter in the lower lid. The difference is very subtle and most likely not clinically significant. I will go into more detail about the impact of contact lens wear and also the impact of demographic on morphology in tomorrow's hot topic session. It starts at 8. And Dr. Dre Liu is also going to talk about the between eye symmetry and also upper lid asymmetry in the later session in meibomian gland dysfunction, which starts at 11. So if you'd like to learn more about our technology, you can go ahead and scan this QR code for our publication. Thank you so much.